Today, our group is going to be arguing in favor of participation in physician-assisted suicide. Our group members are Carly Brown, Bree Walker, and Chandler Beck. Okay, so I'm Bree, and I'm going to be discussing the case background for this presentation. So the case that we will be discussing today is about a patient named Mr. Canton who has been treated by Dr. Watson for several years and has found out that he has metastatic pancreatic cancer. Mr. Canton decided to participate in chemotherapy after finding out that his tumor was inoperable and that this was the best option to slow down the growth of his tumor. After participating in the chemotherapy, he still was only given 3 to 5 months to live. After spending 1 month in palliative care, Mr. Canton has asked Dr. Watson for a secobarbital prescription, which is commonly the drug used to prescribe for physician-assisted suicide. Although physician-assisted suicide was legalized in Vermont in 2013, and Dr. Watson knows that he will not face any legal issues if prescribing this medication, he is still unsure that this is the moral thing for him to do. Today, the question that we are asking is, should Dr. Watson assist the patient and prescribe the secobarbital and aid the patient's end-of-life care, or should he refer the patient to another physician because physician-assisted suicide is not morally correct?
With Mr. Canton's current diagnosis and condition, Dr. Watson should be required to fulfill Mr. Canton's request for assistance in committing suicide. As Mr. Canton's physician, for many years, they have established a well relationship to comfortably talk about Mr. Canton's wishes to end his life. My first argument as to why Dr. Watson should fulfill Mr. Canton's request to die is because death is not fair and is often cruel. Specifically, in Mr. Canton's case, he is suffering from metastatic cancer that has given him less than 5 months to live, leaving him to die in anguish. Although Dr. Watson has most likely presented Mr. Canton with other treatment options, not all pain can be treated with palliative care and medications, especially those suffering from metastatic cancer. Symptoms such as nausea and weakness are often side effects that stem from the treatments and medications that Mr. Canton may experience if another round of chemotherapy is used. As Mr. Canton's doctor, Dr. Watson does not want his patient to suffer and knows that pain is the most common symptom in dying patients. Allowing him to commit suicide gives Mr. Canton a sense of control, which leads to my next argument. Patients exercise self-determination most dramatically when they ask that life-sustaining treatment be withdrawn. In Mr. Canton's case, he is practicing his self-autonomy and self-determination when requesting for assistance in suicide. For those of you who do not know what autonomy and self-determination is, it is the right or condition of self-government and the process by which a person controls their life. As Mr. Canton's current condition right now, he is still in the capable mental capacity to make decisions for himself. And by the state of Vermont, Act Number 39 of an act relating to patient choice and control at end-of-life states that the patient must be mentally competent to make and communicate healthcare decisions. Otherwise, they are referred for a psychological exam. And in this particular case, Mr. Canton has not been deemed of impaired judgment. Mr. Canton has the right as a citizen in the state of Vermont to request this wish because he was diagnosed with less than 6 months to live, and because the disease has progressed too far for a curative resection for his pancreas. According to Act Number 39 in Vermont, a patient with terminal condition who self-administers a lethal dose of medication shall not be considered to be a person exposed to grave physical harm, meaning if Mr. Canton's wishes to take a lethal dose to end his life, he is legally not causing self-harm. Using the term suicide depicts a harsh picture in anyone's mind. However, with Mr. Canton's diagnosis, he is merely doing this to avoid suffering, keep his dignity, and practice his self autonomy and determination. Another reason why Dr. Watson should respect Mr. Canton's wishes and help him is because it may be inappropriate to provide treatment at the end of life because it can be more harmful and draining, such as physically, mentally, emotionally, and financially. Treating Mr. Canton with another round of chemotherapy may cause more harm than good to his body. Because there is no cure, all the chemotherapy would be doing is putting more harmful chemicals in his body and will only slow the disease, not cure it. It is the patient's right, and dying holds great indignities and existential suffering. When a patient is suffering, family members and even doctors have a hard time witnessing the process. However, it has been proven that when a patient is suffering and passes, family members and doctors even feel a sense of relief for the patient because they are at peace now. If Mr. Canton were able legally to take the prescribed dose that Dr. Watson is to give him, he can peacefully end his life whenever he may choose, rather than having family members involved, possibly creating further issues. Dr. Watson should help fulfill Mr. Canton's request to commit suicide because the physician should consider the patient's autonomy and suffering when deciding upon their care. Given the prognosis of Mr. Canton living no more than 5 months is enough to see that he is suffering and there is no more treatments available to sustain his life. As his doctor, Dr. Watson is obligated to give his patients that best care in the patient's best interest, regardless of his question to his own morals. When it comes to a dying patient, it is the patient that is most important, and they should come first. Although it is not required by law for the physician to comply in the state of Vermont, the physician should not allow any moral or personal feelings get in the way of the patient's rights and accept the wishes of the patient. This is very important in establishing a patient-physician relationship because it instills trust for when the patient is in a hard decision but has the correct support. Dr. Watson should be required to fulfill Mr. Canton's request for assistance in committing suicide because Mr. Canton has come to the acceptance of his end of life and is suffering.
Next, we will analyze some possible counterarguments that opponents of Dr. Watson's participation in Mr. Canton's assisted suicide would bring up in a debate. One argument is that participation by prescribing psychobarbital has no physiological benefit to Mr. Canton. This is because it eliminates any chance of recovery and makes any effort to preserve life no longer possible. So basically, in short, from the bioethics perspective, two important principles are being violated here: the principle of beneficence and the principle of non-malfeasance. In order to respond to this argument, we have to acknowledge a few different things here. First, we have to acknowledge that death is inevitable. We know that the patient has already received a prognosis of only a few more months to live. We also know the patient has already demonstrated intent to die by already asking Dr. Watson for a prescription for psychobarbital. So these two observations mean that the chance of his survival, much less his recovery, is already minimal and highly unlikely. Since he's already demonstrated some intent to die, it can also be inferred that he has also determined that his quality of life would be better if he were to die now. Secondly, we have to answer this question: what is a physician's objective? A few different ways that we came up as a group were maintaining health, maintaining well-being. And with today's understanding of what the role of the doctor is, we have different documents from the UK's National Health Service. Numerous different articles have been published before, but basically the consensus is this: good health is more than solely a physiological state. It also includes emotional and mental well-being. With this in mind, we also need to remember that this is one of, if not the most emotionally traumatic events in Mr. Canton's life. Death and dying evokes a myriad of different feelings and emotions, but when considering his prognosis and the pain of chemotherapy that he has already gone through, this is of course emotionally hard, and of course it's incredibly difficult. Previously, we already established that good health is more than solely a physiological state, but it also includes emotional and mental well-being. We also understand that a doctor's role is to maintain health. So interestingly enough, the UK National Health Services released the role of the doctor consensus statement that basically began with this description of the physician's role. Doctors as clinical scientists apply the principles and procedures of medicine to prevent, diagnose, care for, and treat patients, and to maintain physical and mental health. So we have an understanding here that health is a little bit more than just the physical status, but we know that it also includes the emotional and mental health of the patient. So this is true. If this is true, then we have to answer this next question. Who is best equipped to support Mr. Canton? So we know a few different things here. First, we know that this decision is a medical decision. Dr. Watson, as a general physician, understands the medical basis and the scientific basis for all of the decisions that are being made here, and is in the best position to support him as a decision maker, as support Mr. Can's decision here. But also, not only that, he's able to support him as a person. We know that Vermont law in Act 39 states that there must be some sort of bona fide relationship with the patient, which means that there must be an established relationship between the patient and the physician prior to his ask. We also know that Dr. Watson's role is to make decisions based in the best interest of Mr. Can's health and well-being. And because of our prior understanding, we know that that means that he has to emotionally and mentally support him here. Also, we really do need to note that refusing to participate and not treat and actually referring the patient to another physician can do a lot more harm than good for Mr. Canton. Changing doctors is already hard enough and is already stressful when you're not dying. But doing it with a few more months to live makes it even harder, and the support is actually being revoked here. So basically what we're arguing here is that in short, Dr. Watson can better support his patient by participating than if he were to not participate. Basically, Dr. Watson is in the best position to support as a medical advisor and then also support Mr. Canton as a person. He's one of the few people that doesn't need more context about Mr. Canton's health and his prognosis, which means that he can devote time to emotional and mental health care. Referring him elsewhere and refusing not to treat him doesn't achieve the goals of what a physician ought to be doing. But by participating, he can actually support him through this stressful time. And plus, he doesn't violate the principles of beneficence and non-malfeasance, but instead he actually is able to provide more support and upholds those. So in closing, we recommend that Dr. Watson ought to participate by prescribing secobarbital in order to respect Mr. Canton's wishes of easing his pain, respect his autonomy, and to fulfill Dr. Watson's responsibility to emotionally and mentally support his patients. Thanks for listening, and that's it.